Colon and rectal cancer right now is one of the most dangerous diseases all around the world. Today I'm going to help you a lot with the information that I can provide you. What is the best vitamin that can help you to reduce risk of colorectal cancer? This vitamin has a very good health benefits for our body. Everything you will be learning in today's show. At the end of the show, I will give you food sources of this vitamin, also a recommended daily dosage for you to prevent one of the most dangerous disease in the world, that is colorectal cancer. I will advise you about the several more extraordinary natural ways of preventing this serious disease. The best vitamin for preventing colon cancer is vitamin B9. It exists in two types, folate and folic acid. Folate is found naturally in the food sources, and it also is known as folacin, folic acid, or peroglutamic acid, or PGA. Folate is considered a brain food and is needed for energy production and the formation of the red blood cells. It also strengthens immunity by aiding in the proper formation and functioning of the white blood cells. Because its function as a coenzyme in the DNA and RNA synthesis, it is important for the healthy cell division and replication. It is involved in protein metabolism and has been used in the prevention or treatment of folic acid anemia. Because this vitamin is so good for the colorectal cancer, about that a little bit later, we must know, and you must know, when you take vitamin B9, it's going to help you a lot with relieving symptoms and diseases like psychological character. This is stress, anxiety and depression. You will resolve with the good quality vitamin B9. People with Alzheimer diseases who received supplementation folic acid 1.25 milligrams a day for the 6 months had better cognition compared to a group of similar patients who did not get any kind of supplements. Folic acid may reduce inflammation, which is associated with Alzheimer's disease. Folate may be the most important nutrient in regulating homocysteine levels. Homocysteine is an amino acid that is naturally formed in the body as a result of breakdown of another amino acid, methionine. In recent years, high level of homocysteine has been found to be associated with increased risk of atherosclerosis. This means when you take vitamin B9, you reduce risk of the stroke and the heart attack. Also, number 1 and number 2 causes of death in the world, what is very good information. In order for this conversation to take place as it should, the body needs an adequate supply of folate as well as of vitamin B6 and B12. Homocysteine levels in the red blood cells have been shown to have an inverse relationship to levels of those 3 important vitamins. This is, the lower levels of those vitamins, the higher the level of homocysteine. Folic acid may help you reduce risk of stroke. People who take in blood pressure lowering medication were randomized to folic acid 0.8 milligrams a day or none. Those getting the blood pressure drugs and folic acid had significantly decreased in development of stroke. Colon cancer is the second most common cancer in country all around the world, and right now, and this is very well researched, vitamin B9 has very strong anti-cancer properties. That means when you want to prevent this serious disease, you need to take good quality food that is in high concentration of vitamin B9, take high quality B9 supplements. Also, you must take it into consideration because you need to be sure to take together vitamin B9 with vitamin B6 and B12 because together they work great in the body. It plays a role in the production of neurotransmitter such as serotonin. Another important recommendation: zinc and vitamin C play a key role in the decomposition of the vitamin B9 in the body. So you need to take them together. That means if you take high quality food with vitamin C, also with the zinc and vitamin B9, you get a very good composition that is going to be a great health benefits together in the body. So you need to remember this: zinc, vitamin C and vitamin B9 is going to help you a lot in reducing risk of the colon rectal cancer. This vitamin is recommended for the prevention of osteoporosis. It will also protect you from occurrences of arthritic changes in the joints and help reduce symptoms of restless leg syndrome. Study shows that the low folate levels can be associated with the development of restless leg syndrome, especially during the pregnancy. A sore red tongue is the one sign of folate deficiency. Other possible signs include anemia, apathy, digestive disturbances, fatigue, graying hair, growth impairment, insomnia, labored breathing, memory problems, paranoia, weakness, and the birth defects in one of offspring. Folate deficiency may be caused by inadequate composition of the fresh fruit and the vegetables, and that's why you need to take very serious into consideration for all these problems. Of course, especially for today's show is the important reduction in the risk of getting colon rectal cancer. That's why right now I'm going to recommend you the best food that contains high quality vitamin B9. This is asparagus, avocados, barley, beef, brown brewers used, brown rice, cheese, chicken, dates, green leafy vegetables, lamb, legumes, lentils, liver, milk, mushroom, oranges, split peas, pork, root vegetables, salmon, tuna, wheat germ, whole grains and the whole wheat. Unlike most other nutrients, synthetic folic acid from the supplement is more bioavailable than folic acid from the food. It's the best to eat folate-rich foods and to take supplements, especially if you are a woman in childbearing age. That is very important to know. Usually you take the food that would be great, but it will be also great to take a high quality supplements. This is something special with vitamin B9, and usually when you take any kind of supplements, on the box of the supplements that you're going to buy, it's going to be recommended daily doses. For those who don't know this and want to prevent colon rectal cancer, most adults need 400 micrograms of folate 2 times a daily, but daily requirements increase for the pregnant or nursing woman who needs 500 micrograms a day. To prevent colon cancer, you should also take calcium 500 milligrams 2 times a daily, magnesium 200 milligrams 2 times a daily, vitamin D 1000 to 2000 international units every day, and coenzyme Q day 10-19 milligrams daily. This is my recommendation that is very well studied in studied research and help a lot of people, just because this is one of the most serious diseases around the world. So this is my recommendation. Gladly I give it to you every day. Till the next time, bye bye. For the last 25 years, I'll be working with the patient all around the world. I proudly can say I cured thousands and thousands of people. My specialty to heal you with the help of my programs of natural medicine and nutrition. By following Mario Lab Natural Treatments program, you enable yourself to be permanently healthy without drugs and any kind of surgeries. For certain conditions and diseases, in my office we use medical, physical therapy and rehabilitation treatments. If you want me to treat you, call the Mario Lab Center in Zagreb, Croatia, or visit mariolab.hr, my new website where you have all necessary information. The links are located below the video. Complete treatments, my phone consultations are doing in Croatian and also in English language.